This is PAC 365. Myself, Srija. Today, you are going to learn about the diseases of respiratory system and their isolate and classification of diseases. So, the diseases of respiratory system codes range from J00 to J99. So, what is the function of respiratory system? So, the respiratory system, it helps our body breathing oxygen and it removes the carbon dioxide. So what does it include? It includes nose, pharynx, larynx, trachea, bronchi, bronchioles and lungs. So these parts work together to help us to breathe and exchange the gases between the body and the environment. So what are the common respiratory diseases? Respiratory diseases are very common and can range from mild to severe. So what are the mild conditions? Like common cold, mild throat infection. So what you face in day-to-day life. So what are the serious conditions? Pneumonia, like lung infection, asthma, airway narrowing, and also the COPD and sometimes the respiratory failure. So when lungs can't provide enough oxygen, the lungs fail, right? So that results in the respiratory failure. So these respiratory diseases affect breathing and oxygen supply, which can impact the entire body. So the ICD-10 CM classification, nothing but it's the International Classification of Diseases, 10th revision and clinical modification. They provide codes for all the diseases. So this chapter 10, J00 to J99, it covers the diseases of the respiratory system. So what does these codes do? These codes help to doctors to record and track the diseases properly. The medical coders, they assign the correct codes for billing and reporting. They also help the health institutions to analyze the data and the respiratory diseases. So what are the purpose of these codes? So these ICD-10 CM codes help in recording, classifying and analyzing the respiratory diseases properly. So they also maintain the uniform documentation in hospitals and clinics. They also support the research, public health studies, billing and insurance. So these codes make sure all the healthcare workers speak the same medical language when describing a certain respiratory disease, right? All the workers who involve in this medical language should have the same medical terms, should use the same medical coded words so that it is easy to understand to them and code accurately. So how does these codes got organized? So these codes are arranged based on their anatomical site and pathological process. So what is anatomical site? Where in the respiratory system the disease occurs. For example, a part of nose or lungs. So coming to pathological process, so what is the type or cause of the disease? Like infection, inflammation, chronic condition, etc. So what code ranges are there in the respiratory system? So J00 to J06. What it is? Acute upper respiratory infection. So for example, common cold or sinus infection. Acute means a short term, right? It's a short term which can be cured easily. So J09 to J18, influenza and pneumonia, like flu and lung infections over here. And J20 to J22. So these are other acute lower respiratory infections. So what are the lower respiratory organs? Like bronchi, bronchioles. So infection related to the bronchi, bronchioles like bronchitis are involved in J20 to J22. So coming to J30 to J39, this is the other disease of the upper respiratory tract. So what does this include? Chronic sinusitis and also laryngitis, nothing but inflammation of the sinuses and larynx. So coming to J40 to J47, this describes the chronic lower respiratory diseases. So this include asthma and COPD, which are chronic. So J60 to J70, lung diseases due to external agents. This is external agents like dust, chemicals and fumes. So lung disease are caused by due to these chemicals, dust and fumes like external agents. So J80 to J84. So these include the other respiratory diseases principally affecting the interstitium. So like acute respiratory distress syndrome, and also the interstitial pulmonary fibrosis. And J85 to J86, suppurative and necrotic conditions of lower respiratory tract. What does it mean? This includes severe infections causing suppurative. Suppurative means causing pus, and necrotic. Necrotic means necrosis, tissue death. So, for example, lung abscess and empyema, nothing but forming the pus in the pleural cavity. So, these are the complications of the pneumonia and the aspiration. So, J90 to J94, it involves the other diseases of pleura. Pleura is nothing but it's a thin membrane covering the lungs, right? It's a double membrane, right? So, this category, it includes the conditions such as pleural effusion, pneumothorax, and the other pleural disorders. So these diseases affect the lining of the lungs but not the lung tissue itself. It affects mostly the lining of the lungs. So coming to J95 code, it involves intraoperative and post-procedural complications and also the disorders of the respiratory system not elsewhere classified. Means these are the complications post-procedure, means after surgery, or medical procedures involving the respiratory system. So what is the example like post-operative respiratory failure? After the post-procedure, if the lungs got failed, so then J95 like codes are assigned. So coming to J96 to J99. This covers other diseases of respiratory system. So this covers miscellaneous and complex respiratory disorders, so which are not included elsewhere. So the codes which are not included above all the codes, and that codes are involved and coded over here. So this, it represents as the miscellaneous section of the respiratory problems. So we will learn about each and every code description briefly. Yeah. Diseases of acute upper respiratory infections. So this ICD-10 CM code ranges from J00 to J06. So acute upper respiratory infection. So what do you mean by acute upper respiratory infection? These are short-term infections. So what does this affect? Upper part of the respiratory system. Nothing but the part above the lungs. So what are the parts in the upper part of the respiratory system? Nose, nasal cavity, sinuses, throat, and voice box. So what are the causes of these infection? They are usually caused by the viruses and also sometimes bacteria. So what are the common symptoms? Runny or stuffy nose, sore throat, sneezing, coughing, fever, nasal congestion, hoarseness. Hoarseness means change in the voice. So these infections are very common in all the age groups, especially during the seasonal changes. Like seasonal changes means like winter or rainy season. So whenever season is changed, so these infections are very common seen in all the age types of people. So these codes are used to record and classify specific upper respiratory infections such as J00. It is acute nasopharyngitis, nothing but common cold. Short duration. Acute means short duration. Naso means it's nose. So pharynge means it's a pharynx. Itis, so inflammation. So the most common infection is acute nasopharyngitis. It is mainly caused by the viruses. So what are the symptoms? Runny nose, sneezing, sore throat, mild cough, and also the low fever. So coming to J01, acute sinusitis. It is nothing but the infection and inflammation of the sinuses. Sinuses are nothing but the air spaces in the skull. So what is the example of acute sinusitis? Like J01.0, acute maxillary sinusitis means the infection in the maxillary sinus. The infection in the maxillary sinus is called as acute maxillary sinusitis. So whenever the provider documents this acute maxillary sinusitis, then assign the specific code J01.0. So what you will be seeing the symptoms of this sinusitis? facial pain, nasal blockage, headache, and also the thick mucus. So this diagram, it shows the sinus inflammation and mucus buildup. So coming to J02 code, it's acute pharyngitis. So nothing but infection of the throat. Throat is also called as pharynx. So what is the example? J02.0, streptococcal pharyngitis. So you can see the symptoms like sore throat, pain while swallowing, red throat, and also the fever. So J03, acute tonsillitis. So inflammation of the tonsillitis. For example, J03.8. And then J04 for acute laryngitis and tracheitis. Nothing but infection of the larynx is acute laryngitis and infection of the trachea is tracheitis. So you can experience the symptoms like hoarseness, loss of voice, cough, and also the throat pain. So J05 for acute obstructive laryngitis and J06 for acute upper respiratory infections of multiple and unspecified sites. So these are used when infection affects more than one part of the respiratory tract, like both throat or sinuses or lungs or alveoli. So the first picture, it describes the sinuses. Sinuses are nothing but the air-filled spaces around the noses and eyes. So how they look when inflamed during sinusitis. Here you can see the normal sinuses. Normal sinuses are nothing but they are the hollow air-filled spaces that help humidify air and also they reduce the skull weight. Whereas in sinusitis, the inflamed sinuses, the sinus lining becomes swollen. You can clearly see here the lining becomes swollen, means inflamed. So the sinus opening, it gets blocked, leading to the mucus drainage. So when this sinus opening gets blocked, so it prevents the mucus drainage, right? So what happens when it prevents the mucus drainage? This fluid and mucus build up inside. As the mucus is not drained, it will be left inside, so it will build up inside, which leads to the pressure and pain. So then you can feel the facial pain, headache, nasal congestion, and also the thick discharge. So these are the type of sinuses: frontal sinus, ethmoid, sphenoid, and maxillary. Frontal sinus, where it is above the eyes in the forehead area. Ethmoid, between the eyes. Sphenoid, deep behind the nose, and maxillary, below the eyes in the cheekbone area. So the next picture is tonsillitis. Tonsillitis is nothing but inflammation of the tonsils. So this image, it compares the normal tonsils with the tonsillitis. So in normal tonsils, you can see a small pink color smooth structures at the back of the throat over here. They help trap to germs and also they produce antibodies. Whereas in tonsillitis, here you can see the tonsils became red, swollen, and also the painful. So white patches or pus, you can see here the white patches and pus that appeared on the surface. So what does this do? They cause sore throat, fever, and difficulty swallowing. So tonsillitis is nothing but it's an infection of tonsils causing redness, swelling, and throat pain. So this is about the J06 code. And then coming to J09 to J18, what are they? ICD-10 CM code ranges for influenza and pneumonia. So this ICD-10 CM codes cover acute infections of the lower respiratory tract, mainly affecting the lungs. So what are these infections caused by viruses like influenza, bacteria, and other germs? So the severity can range from a mild flu to serious pneumonia. So see, what does it mean by serious pneumonia? It's nothing but life-threatening. So what are the causes for these influenza and pneumonia? Influenza viruses, bacteria, and sometimes both a person can have both the flu and also the pneumonia together. So what are the common symptoms of this influenza and pneumonia? Like fever, cough, sore throat, body aches, chest pain, discomfort, and breathing difficulty. So coming to the code classification, J09, what it is? Influenza due to certain identified influenza viruses. So this influenza is due to the certain identified influenza viruses. For example, when influenza is due to the identified influenza virus with pneumonia, so you have to code J09.X1. So when it is due to other identified influenza, you have to code J10.01. So coming to J11. J11 is influenza due to unidentified influenza viruses. So this code, it is used when the flu virus is not specifically identified in the lab test. For example, influenza with gastrointestinal manifestation. So what it is gastrointestinal manifestation? Means symptoms like nausea or vomiting. So you have to use this code when doctors diagnose flu based on symptoms only, but there is no virus testing done. Only based on symptoms you have to code this J11.2. And then coming to J12 code, it is viral pneumonia not elsewhere classified. So what does this code covers? So these codes covers the pneumonia caused by viruses other than respiratory syncytial viruses. So viruses other than RSV virus, you have to code over here. You have to code J12. You have to assign this code. For example, J12.1. What it is? RSV pneumonia, which is common in infants and elderly people. So the diagram on the right shows the structure of RSV virus, means respiratory syncytial virus. It includes outer lipid layer and the surface proteins that help it infecting the lung cells. So what is J13? Pneumonia due to Streptococcus pneumonia. So what is this type of pneumonia? It's a common bacterial infection. So this can be lead to fever, chest pain, and also the difficulty breathing. Sometimes it is also called as pneumococcal pneumonia. Right? You got it right? So next J14. It's a pneumonia due to Haemophilus influenza. So what it is caused by Haemophilus influenza bacteria. So it is a bacterial infection. This mainly affects children and other adults, and these can follow the upper respiratory infections. Only upper respiratory, but not the lower respiratory. So J15, it's a bacteria pneumonia not elsewhere classified. So this is used when pneumonia is caused by the other types of bacteria. For example, J15.1. So this is used pneumonia due to Pseudomonas, and this is more common in hospital acquired infections. So this image, it shows the Pseudomonas bacteria, which is a rod-shaped germs that can cause severe lung infection. So this is especially in weak or hospitalized patients. You can see this Pseudomonas infection. And then J16. What is J16? Pneumonia due to other infectious organisms not elsewhere classified. So what does this code describes? It is used when pneumonia is caused by less common organisms that don't fit into previous categories. So when the organisms that doesn't fit into previous categories, as I have showed you in the previous slide, so those common organisms are involved in J16. For example, J16.0, chlamydial pneumonia. So what do you mean by chlamydial pneumonia? Chlamydia, it's a bacterium that infects the respiratory tract. So what are the symptoms? Include persistent cough, fever, and also the mild pneumonia. So these are often mistaken for the viral infection. So here you can see a clear picture of the chlamydia pneumonia. So what are the steps in the chlamydia pneumonia? So this is a life cycle of the chlamydia inside a host cell. So you can see the elementary body. It's a small infectious form which enters the host cell via the endocytosis. And next, phagosome formation. The elementary body, it is enclosed in a vesicle called as phagosome. Phagosome is nothing but chlamydia inclusion. So then the EB transfers into reticulate body, which is the active replicate form. So elementary body into replicative body. So then replication takes place by, replication is nothing but multiplication of the cells. So it is done by the binary fission. And after binary fission, the secondary differentiation. So what is secondary differentiation? The reticulate body, it converts back into the eliminatory body. That is RBs convert into EBs. So then lysozyme release. In this, the host cell burst, releasing new EBs that affect the other cells. So this chlamydia pneumonia, it behaves like a virus, but it is a bacterium. So chlamydia, it's a bacterium, but it behaves like a virus in the respiratory system. So coming to J17 code, pneumonia in diseases classified elsewhere. So this is used when pneumonia is a complication of another disease, but not pneumonia as a primary infection. For example, when pneumonia is developed due to measles virus, so you have to use this code J17. When pneumonia is developed due to tuberculosis, you have to assign code J17. So in this coding, what happens? This pneumonia is used as a secondary diagnosis because this pneumonia is caused by the another virus, right? So the reason for the other virus should be coded as the primary diagnosis, and this pneumonia is coded as the secondary diagnosis. You got it right? So the J18 code, what it is, it's a pneumonia unspecified organism. So this code, it is used when the causative organism is not known. The description itself tells you the unspecified, means the causative organism is not known. For example, J18.1, that is lobar pneumonia, unspecified organism. So these are commonly used in clinical settings where lab confirmation is not available. So lobar pneumonia, it means that the infection affects only one lobe of the lung. Lobar means one lobe of the lung. So which is leading to the consolidation. Consolidation is nothing but the solidification of the lung tissue due to the infection. And that's it. This is for today's session. In the next session, you will be learning about some more isolated classification of the respiratory diseases. Thank you.